A new study shows just how successful British Columbia has been at containing COVID-19. The findings, which still have to be peer-reviewed, suggest only a fraction of the province's population became infected before restrictions were eased. But as Mickey Cowan reports, that achievement could actually make it more difficult to push back a second wave.
Research finds less than 1% of BCers had COVID antibodies or had the disease. The data comes from serology testing back in May, meaning efforts to stop the spread overall worked quite well. Measures like wearing masks, closing down facilities, and limiting public gatherings.
What it does show is the efforts of communities of flattening the curve that all British Columbians took part in that have been extraordinarily successful.
But health officials agree that success is a double-edged sword. Because there have been so few cases in BC, that means there's little immunity in the general population. And that could have big effects in the fall if there is a second wave.
If there is, for example, a community spread of infection, there will be a large number of people who are susceptible to it.
So don't expect physical distancing guidelines to relax anytime soon, especially with new data confirmed by the study.
There are more people who were infected with COVID-19 than tested positive, and that's something we said clearly.
About 8 times as many people had COVID than tested positive for it, the data suggests. So those community cases are out there. As for whether the low rates are going to change reopening plans in BC,
we're constantly assessing the evidence.
No clear word from health officials just yet. Mickey Cowan, CBC News, Vancouver.
With more now about this study and the latest COVID-19 news, I'm joined by Colin Furness. He's an infection control epidemiologist and an assistant professor at the University of Toronto. Good morning. Thanks for your time today.
Good morning.
What do you make of those results we just heard about out of British Columbia?
It's fascinating because this is the first seroprevalence data that we've seen in Canada. This is the first independent measurement of how many people got COVID compared to how many people tested for it. So it's very preliminary. It's a very small sample size. One more positive case either way would have dramatically changed their findings. So I don't think this is the definitive study of how COVID moved through BC or through Canada, but it's a very interesting start.
The study also screened for antibodies, and in April, 2 samples tested positive for COVID-19 but had no antibodies. In May, 4 tested positive, and they all had antibodies. What does that tell you?
That makes sense because your body takes a while to produce antibodies. So that means that at the very beginning, they obviously caught 2 samples or 2 cases right at the beginning of their infection. And in May, obviously, those 2 samples, those 2 cases had already been infected for some number of weeks. So that makes sense. That's what that means.
Okay, so I was wondering if there is a low presence of antibodies in the population, does that mean more people will be vulnerable to the virus if another wave hits?
Yes, that's true. But even if you quadrupled the number of people who'd been exposed, that statement would still be true. In other words, until you have a sizable proportion of the population being exposed, something like 60 or 70 or even 80%, you're still going to get spread. So the fact that only 1% as opposed to 3 or 4 or 5% were exposed, I don't think that's actually going to matter much. We have a susceptible population in Canada, coast to coast, and that's something that we should be proud of and also, yes, concerned about in terms of what happens in the fall.
And we still don't know, do we, whether or not antibodies can give one long-term protection?
It's complicated. There's 5 different kinds of antibodies. 3 of them we understand reasonably well, and they're all behaving differently than we might expect with respect to COVID. It looks like if you've had a severe illness, your antibody levels stay up. If you've had a mild illness, not so much. And whether that then means you're more susceptible to reinfection, we're going to have to find out. That's the thing, is we can't actually predict the behavior just based on the antibodies, but it's equivocal. It's hard to know.
Okay, I want to ask you about some other news that was coming out yesterday on COVID. Ontario are now relaxing visitation rules at long-term care homes as the province reported the fewest COVID-19 cases since March. So they're allowing 2 people at a time and even allowing indoors under certain restrictions. What's your advice for these facilities to monitor those going in and out of them?
I think For the residents who live there, it is high time that they be able to have visitors. I think I would still encourage outdoor visits as much as possible. It's also a good time to think about how to redesign these facilities for safer indoor visits. I'd like to see how the ventilation systems might be changed or improved. For the moment, it does make sense to do that. We have very low community spread, but I would also like to see screening at the door, temperature and blood oxygen level as well, just to be as cautious as possible, given the history that we've had.
Do you share some of the concerns we've been hearing around fall and winter when visits will naturally have to all move indoors, for example, and the fact that the virus might be happier and thrive indoors in the colder weather?
I share all of those concerns. There's no question. All respiratory viruses are seasonal. They all have that pattern. So does COVID. It can spread in the summer too. Obviously, we see that. But the winter is when it has far more ideal conditions. The air is drier, the air is colder, people are indoors. And it's that indoor proximity in poorly ventilated spaces that we should be most concerned about. So I would be looking very carefully in long-term care homes, in any kind of public place. How is the ventilation? Can we improve it? Can we fix it?
We're starting to get a bit of a sense of what fall might look like for some school boards, at least financially. The largest school board in the country, the Toronto District School Board, yesterday telling of dire numbers of the cost of making schools safe under COVID-19 plans. For example, far fewer children per classroom, might have to hire a lot more teachers and cut back on certain subjects. What's at the top of your mind as a concern about children going back to school?
We need to try and get kids back into school full-time in the fall. We need to make that a #1 priority. And the big concern I have had over the last few days is the announcement that we're going to open bars and restaurants indoors in Ontario, and that we're going to do that first. That's a problem because wherever that's been done, in Canada and elsewhere, we've seen a major rise in cases. If we have a major rise in cases, it may imperil our ability to open schools at all. So I'm very concerned that we prioritize schools first, bars second.
So if we look at that model, then how concerned should we be about children possibly being vectors for the virus?
Normally with respiratory viruses, we're quite concerned about kids, and this is why we close schools first. This is anyone who has kids knows that they get into everything. They bring every cold they can home. What we see with the evidence with COVID, the emerging evidence, is for reasons we don't understand, kids do seem to be less infective. We already knew they were asymptomatic. They seem to be less infective. The problem is we don't understand the biology of that. It's quite a mystery for the moment. So it's pretty hard to just accept that unquestioningly and say, great, let's open schools and not worry. But the preliminary evidence suggests that it is less risky to do it than we might have otherwise thought.
All right, and just weeks away, really. So people will be asking lots of questions in the days ahead. Thank you for your insights today. Much appreciated.
My pleasure. Thank you.
Colin Furness is an infection control epidemiologist and assistant professor at the University of Toronto, joining us from Toronto.